Your dog just chewed through your couch cushion again. Or maybe they've been barking non-stop, snapping at your kids, or dragging their butt across your brand new rug. And you're thinking, what is wrong with this dog? Here's what nobody tells you. Some of the most bad dog behaviors, they're not bad at all. They're your dog screaming in the only language they have that something hurts. And if you punish them for it, you're not fixing the problem. You're making it worse. I'm going to show you 7 specific behaviors today that millions of dog owners misread every single day. And I'll tell you exactly what each one actually means and what to do about it. Stay with me. Number 4 is the one that's going to hit you hard. Let's talk about something uncomfortable for a second. We love our dogs. We do anything for them. But we are also, and I say this with full love, spectacularly bad at reading them. Think about it. When a dog misbehaves, the default response is usually one of 3 things: punishment, frustration, or Googling how to stop dog from insert behavior. And none of that addresses the actual root cause. Here's the thing. Dogs cannot walk up to you and say, "Hey, my left hip has been aching since Tuesday and it's making me really irritable." They can't do that. What they can do is behave differently, act out, get weird. And we, they're humans, the people they trust completely, look at that behavior change and go, bad dog. Action. Cut to montage of common bad dog behaviors: chewing, growling, hiding, scooting. Research in veterinary medicine has shown for years that behavioral changes are one of the earliest and most reliable indicators of pain in dogs. Pain changes everything: their sleep, their appetite, how they interact with people, how they respond to touch. The problem is that the gap between my dog is acting up and my dog might be hurting is enormous, and most owners never make the jump, until today. Here are 7 behaviors that are easy to misread, what they're actually telling you, and when you need to get to a vet. You've had your dog for years. They're gentle, calm, great with the kids. And then one day, completely out of nowhere, they snap. Maybe at your kid reaching to pet them, maybe at you when you go to pick them up. And your first reaction is, what happened to my dog? Is this a dominance thing? Did I do something wrong? Here's what's almost certainly actually happening. They're in pain, and you just touch the spot that hurts. This is called pain-elicited aggression. It's one of the most well-documented phenomena in veterinary behavioral science. A dog that has never shown a moment of aggression in their life can snap or even bite when someone makes contact with an area that's inflamed, injured, or chronically sore. Think about it from a human perspective. If you had a badly sprained ankle and someone accidentally stepped on it, you might yell or flinch or push them away. You wouldn't be a bad person. You'd be a person in pain. Your dog is doing the exact same thing. Common culprits here: arthritis, especially in older dogs, hip dysplasia, ear infections, dental pain, a hot spot they've been hiding, or an internal injury you can't see. What to do? Don't scold the snap. Instead, note where the contact happened right before the reaction, and see if your dog shows any other signs: limping, licking a spot repeatedly, reluctance to be touched in a certain area. Then get to your vet and describe the behavior change, not just the aggression. Your dog will not stop licking their paw, or their leg, or their flank. You've told them to stop 100 times. You've distracted them. Nothing works, and it's driving you crazy. Before you buy the 8th bottle of bitter apple spray, let me ask you something. Have you looked at that spot? Because when a dog obsessively licks or chews a single location on their body, it's almost never boredom. It's almost never attention-seeking. It is, in the vast majority of cases, a response to something going on beneath the skin. This could be allergies causing chronic skin irritation, a wound that's healing or not healing, a hot spot, a bacterial infection that starts small and spreads fast, a joint that aches. Dogs will lick the skin over a sore joint, not just visible wounds, a bug bite, a sting, a foreign object lodged in the paw. One of the most misunderstood versions of this is when dogs lick their paws almost rhythmically, especially at night. Owners usually chalk it up to anxiety or habit. Vets will tell you, check for interdigital cysts, allergies, or early-stage arthritis in the toes first. What to do? Part the fur. Look at the skin. If you see redness, swelling, hair loss, or a wound, that's your answer. If the skin looks fine, but the licking continues, the issue may be deeper. Vet visit. I want you to think about your dog right now. Not a hypothetical dog, your dog. Is there something they do that bugs you? Something you've been correcting for months with no real change? Because here's a rule of thumb I want you to write down. If a behavior isn't responding to training, it might not be a training problem. Hold that thought. Let's keep going. Okay, we're going to talk about the butt scoot. It's funny looking. There's no way around it. And the instinct is to laugh, maybe film it, maybe say gross and move on. But scooting is actually one of the more urgent signals on this list. The most common cause, and the one vets see constantly, is anal gland issues. Dogs have two small sacs on either side of their rectum that express a scent fluid, usually during defecation. When those sacs get impacted, infected, or fail to empty properly, they cause significant discomfort. Not just itchiness, real chronic pain. The dog scoots because they're trying to relieve pressure. They're trying to help themselves because no one else is doing it for them. Other causes of scooting include intestinal parasites, worms, allergies causing perianal irritation, or skin infections around the tail base. What not to do? Do not ignore this. Do not just laugh, and definitely do not punish a dog for scooting on your rug. They're not doing it to ruin your carpet. They're doing it because they're uncomfortable. What to do? Check the rear end area for visible swelling, redness, or discharge near the anal glands. If you see any of that, or if scooting is happening frequently, your vet needs to manually express those glands, or in chronic cases, discuss a longer-term solution. This is a quick fix when caught early. An infected, ruptured anal gland is not. This is the one I want you to really sit with. Your dog, who used to follow you from room to room, who slept at the foot of your bed, who greeted you at the door like you'd been gone for a decade, is now hiding under the bed, going to a corner, not engaging, not eating with the same enthusiasm, just quiet. And you think, are they mad at me? Did something scare them? Are they getting old and grumpy? Here's the truth that's going to sting a little. Withdrawal and hiding are among the most serious pain signals a dog can show, because dogs are instinctively wired to mask pain. In the wild, a sick or injured animal is a target. Vulnerability is dangerous. So dogs, even fully domesticated couch-sleeping dogs, still carry that instinct. They hide when something is very wrong. By the time a dog stops hiding their discomfort and starts withdrawing from life entirely, the pain has often been present for a while. This behavior is particularly common in dogs experiencing chronic pain from arthritis or spinal issues, internal conditions, organ problems, cancer, severe dental disease, which causes constant grinding pain that owners almost never see. Neurological issues. What to do? Do not wait this one out. Withdrawal that lasts more than a day or two, especially combined with appetite changes, is a vet call. Not next week, this week. Real quick, if you're finding this useful, hit the like button right now. It sounds like a cliche ask, but it genuinely helps this video reach dog owners who need this information before they punish a dog that's actually in pain. Okay, back to it. 3 more. Nighttime whining or howling is one of the top reasons people surrender dogs to shelters. I want you to really let that land. Dogs are being surrendered because they're vocal at night. And in many of those cases, the dog was trying to communicate pain. Here's what happens at night. Distractions go away. There's no walk to focus on, no family activity, no stimulation. It's quiet. And in that quiet, pain that was manageable during the day becomes very loud. This is especially true for older dogs developing cognitive dysfunction, similar to dementia in humans, or dogs with chronic pain conditions. When it hurts more at night, they vocalize, because what else can they do? Dogs with arthritis often whine more at night because lying still for hours causes stiffness and joint aches that become impossible to ignore. Dogs with gastrointestinal pain, bloat, pancreatitis, stomach issues will often whine or cry, sometimes pacing, unable to get comfortable. What to do? Notice the pattern. Is the whining happening at a specific time? Is the dog circling or unable to settle? Are they lying down in unusual positions? All of this data matters when you talk to your vet. Don't just assume it's separation anxiety. That's a diagnosis by exclusion. Rule out physical pain first. If your dog is suddenly less interested in food, eating slowly, dropping kibble out of their mouth, or only eating soft food, a lot of people will call this being picky. Your dog is not being picky. Eating changes are a pain signal, almost always. The most underdiagnosed cause of this behavior? Dental disease. Studies show that the majority of dogs over age 3 have some form of dental disease, and most owners have no idea because dogs can't tell you their mouth hurts, and they'll keep eating through significant pain right up until they can't. When a dog starts dropping food, chewing on one side, or eating more slowly and cautiously, that is dental pain until proven otherwise. Other causes of eating changes: nausea from gastrointestinal issues, pain when bending down to the bowl, neck or spine problems, mouth ulcers, or pain from swallowing if there's a throat or esophageal issue. What to do? Check the mouth. I know that sounds simple. Lift the lip, look at the gums and teeth. Red gums, brown tartar buildup, broken teeth, or bad breath that's more intense than usual are all flags. And schedule a dental checkup. Many vets recommend annual dental cleanings for dogs the same way dentists recommend them for humans. This one surprises people. Chewing is often the behavior owners are most likely to punish. The destroyed shoe, the gnawed chair leg, the shredded pillow. And chewing can be a boredom or anxiety behavior. But here's what most people don't know. Chewing releases endorphins. It's a natural pain relief mechanism in dogs. When a dog is in chronic discomfort, whether physical pain or psychological distress from untreated pain, they will sometimes increase chewing behavior specifically because it provides temporary relief. Dogs experiencing teething pain chew, but adult dogs experiencing joint pain, abdominal discomfort, or oral pain will also sometimes increase chewing as a coping mechanism. And then there's this. A dog in pain is a stressed dog. A stressed dog has excess cortisol. Excess cortisol drives restlessness, anxiety, and yes, destructive behavior. So, when your otherwise well-trained adult dog suddenly starts destroying things, don't start with the punishment. Start with the question: what changed? What might be hurting? What to do? Look at the timing of the destructive behavior. Is it new? Is it worse? Is it paired with any other behaviors from this list? The hiding, the licking, the eating changes. The more boxes checked, the stronger the case for a vet evaluation. If you've been watching this and quietly running through this list in your head, thinking about your own dog, that's not a bad feeling to sit with. That's you being a good owner. The goal isn't guilt. The goal is awareness. Now let's bring this home. Sudden aggression or snapping, pain-elicited reaction, especially when touched. Obsessive licking or chewing one spot, skin, joint, or deep tissue irritation. Scooting, anal gland issues, parasites, perianal irritation. Hiding and withdrawal, one of the most serious pain signals. Don't wait on this one. Nighttime barking or whining, chronic pain that's louder when distractions are gone. Eating changes or dropping food, dental pain until proven otherwise. New destructive chewing, endorphin-seeking behavior driven by pain or stress. None of these behaviors mean your dog is bad. None of them mean you failed as an owner. They mean your dog is communicating in the only way they know how, and now you know how to listen. The single most important thing I want you to take from this video: when behavior changes, think pain first. 2 things before you go. First, if you have a dog showing any of these behaviors, please don't sit on it. Schedule a vet visit. Describe the behavior change specifically. Tell them when it started, what triggers it, and whether anything else has changed. The more specific you are, the better chance they have of finding the source. Second, if this video helped you see your dog differently, share it. Send it to a dog owner you know, because somewhere out there, a dog is getting scolded for something that's actually hurting them, and their owner just hasn't seen this yet. Subscribe if you want more content like this. We go deep on dog health, behavior, and the stuff vets wish you knew before the appointment.